Hello, I'm Jim Miller. I'm here with Ron Bowers and Henry House. The Flip Side starts right now. Welcome to the show. We're pleased to have with us tonight Nikki Hauser from the Community Free Clinic. Welcome, Nikki.
Thank you.
So, I have a lot of questions.
Okay.
I mean, I don't think we've had someone from the Free Clinic on for a long time, and I think it was pre-Affordable Care Act. So can you start, and we'll go around the table, but can you start, just give us a little history of the Free Clinic?
We actually will be 30 years old next February. So the clinic has been around for 30 years. Started with Dr. Marty Gallagher, who's seen a need in the community. He started actually, from what I understand, in a closet at the Union Rescue Mission, seeing patients 1 day a week.
Wow.
And from there, they moved in '95 to space on West Franklin Street.
I remember that space.
And in 2004, 2005, Hagerstown Heart was located at 249 Mill Street, and it became available. We purchased it, and we've been there ever since.
Wow. Interesting. Henry?
So what type of services are available to those?
We have a wide range. Our biggest is a general practitioner.
So family medicine?
Family medicine,
stuff.
yes.
Okay.
We have people who come in and we are their primary care.
Okay.
So we see them monthly for different services. But we have, we see acute care. We have, our biggest is chronic disease management. So diabetes, high blood pressure, COPD. We see a lot of patients in that area. We have rheumatology, neurology, podiatry. We have a list, an extensive list of services that we provide. And that's all provided by volunteer physicians.
Okay. And if a patient comes in, they don't have insurance, hence the term free
Yes.
clinic. Now, if they have insurance, would you take their insurance or no?
No, we
Okay.
do no billing. We do have resources we can refer them to.
Okay.
So if they come in, and we'll see them on a one-time basis if it's an urgent need. But if they're eligible for Medicaid, we help them apply for that and send them in the direction they need to be able to get those services and find a provider who will take that.
Nicole, I was around when Community Free Clinic started. Remember a lot of what Marty Gallagher did. The viewers that are watching, give them a conceptual idea just what is the Community Free Clinic. I mean, you can talk different things, but you say there's indigent care that is in each emergency room or urgent cares. How do you differ from all of those? How do they wind up to you?
The easiest way for me that I've been explaining it is we're that safety net in the community. So we only see Washington County residents who are uninsured. And you may have somebody who's working 2 or 3 part-time jobs, but they're not eligible for that employer's health care. That's our patients. Or you may have that individual who has left one job and is starting another, and you have that 90-day gap between being eligible for health care at their new job.
You mean over like a COBRA or?
Yes, if they're offered COBRA, but a lot of people can't afford the
Right.
COBRA. So they have that 90 days that they go without insurance. If something happens in that 90 days, we're there for them.
How about if it's specialized?
They can still call, make an appointment, and like I said, there are only, I'm trying to think what we're lacking as far as, we do not do any dental. That's one thing that we don't have the ability to do, is any dental care. But we have physicians that come in that cover every area in the community.
So with the personal mandate that was in play, let me ask the broader question. How did the Affordable Care Act impact your service, and then how, now that it's changing and that we've identified some holes in the coverage, and I think the personal mandate is gone, correct?
Yes.
So how has that impacted your?
Honestly, it has not had any impact on the free clinic.
So you were full up even when the personal mandate was in
Yes.
place? So there were people that still didn't have insurance?
Correct.
Regardless of the law?
Correct. A lot of people found individually, it was more affordable for them to pay that penalty than to actually pay monthly for that health insurance or that coverage. So they were opting to not take the coverage and just be penalized at the end of the year. So we still seen those patients.
Interesting.
Now, if patient needs a prescription, are you a resource to help them with a prescription?
We
or
are.
you refer them out?
We have, we're a dispensary for medications. So if, like the diabetic that's on medications, we have the medicines that come in. Our nurse practitioner, I have one nurse practitioner that is a staff member. She's paid staff, and she can write prescriptions for things that we don't have in.
Okay.
We don't carry any narcotics and controlled medications we don't carry in the facility. They're something that she would have to write. And
What do you find as your major asset as to what you do? What are you most proud of that the Community Free Clinic does that, again, the folks watching the program doesn't know?
And that's a tough one because we do a lot. I guess it would be seeing the patients, seeing the residents in Washington County who they don't have that health insurance, and we are keeping them out of the emergency room because a lot of times they'll use the emergency room as their primary care because they know they can go there, they can get what they need immediately in a crisis situation. So we are preventing that return to the emergency room by seeing them monthly and making sure they're getting the help and the care they need.
Do you get any third-party pay?
We don't accept any, we do no billing, we accept no pay. Everything we do, our funding actually, we're 75% grant funded. So we,
By whom?
lots of different, locally,
Okay.
state, and we've even done some federal grant writing that we,
No Medicaid money comes back into you?
no,
All grant money?
all grant, 75% is grant money. The other 25% is split between our fundraisers and just donations.
Can you get money from the folks that's going to be here after a while from in the community?
Community Foundation?
Yeah, the Community Foundation.
We actually, I believe we have one, we may have two funds set up
Set
at
up.
the Community Foundation, yes.
Wow. So from a practical perspective, how do patients get to you? Do they make appointments? Do they just walk in the door? How does that all work?
Both. We have some that will hear about us and when it's something that is acute that they need direct immediate care for, and they'll just walk in. But most is just calling to make an appointment, and we try and have appointments available. You call and try and get you in within 24 hours of making that first phone call.
And you have hours that are similar to doctor's offices?
We are
8 to 5,
open.
9 to 5, something like
Yes.
that, Monday through Friday?
Monday through Thursday.
Monday through Thursday?
Yes. But now we do have, with having, again, going back to the physicians in the county who volunteer their time, if it's, when they first come in, they see our nurse practitioner. And then if it's something that Mary needs to refer them to a specialist, we have the list of our providers, and she'll refer them to into one of their appointments. A lot of them will come after work and spend an hour, 2 hours in the evening seeing patients once a month. So we have this block of time that we know that physician is coming, and we'll put that patient in with them.
So from a financial standpoint, you talked about 75% grant funded, 25% other funding, including fundraising. Not to be nosy, but I mean, what kind of budget? It's got to be an incredible budget to run this place.
It
Just
is.
the building and that type of thing. And I'm assuming you don't have a mortgage, but
No, we don't have a mortgage. Actually, both buildings are no mortgage because we've got some new things happening also. But our budget right now is about $1.2 million. That's
Okay.
probably going to go up a little bit with the new piece we're adding. We're adding in a community mental health care. We're doing mental health. We have Dr. Gonzalez from Brookline who volunteers. He comes in once a month and manages medications for people who need mental health. But we are starting to do the therapy for the mental health and seeing patients. We have Jeremy Cantner as my mental health director, and he is an LCSWC. So he right now has opened up to, I believe he's got 40 spots a month open for the 1 hour therapy.
So, I mean, just doing back of the napkin math, you've got to make something over $100,000 a month just to keep the lights on.
Yes.
And that's with all volunteer staff saving and accepting one?
No, we have, the staff-wise,
Oh, you have
including
some
myself, there are
administrative staff,
Yes,
okay.
there-
But medical staff, it's all volunteer saving and accepting the nurse practitioner.
the nurse practitioners line. Then I have an RN, an LPN, and a nursing assistant that are staff.
What about the prescriptions? How do you acquire those?
We have companies that we have some contracts with, and we order. We bring them in bulk. We break them down into 30-day supplies, and we dispense them as needed when the patients come in.
And you pay for most of those?
Yes.
Okay. All right, so that's a cost too, and
That
I'm
is
sure
a
a
cost.
significant cost.
Yeah, we actually have a grant that helps with that. We have another grant that helps with lab fees. We do send our patients out for lab work, and we do that through Meritus. And again, we have some grants that cover that, and that's been an ongoing grant that we get every year.
So you have a portion set up as far as in-house, administrative-wise, yourself and a couple other individuals?
Yes.
Okay.
Total staffing, part-time and full-time, are 13, including me.
Okay.
And again, most of that is medical staff. And we will be expanding on that again once the new building is, we're hoping that June, our new building is actually, we can occupy it. We're just waiting now on fire marshal to come in and inspectors to come in and give us the thumbs up.
So will you be moving from Mill Street, or?
No, that's actually, Dr. Katari donated his original office suite to us, which is directly next door. It's at
Okay.
235 Mill Street, and that's going to be the mental health care facility.
Very nice.
When you have a patient comes in and they find out they need more care than what they originally thought, how do they get to the hospital? Do you keep anybody there overnight?
No,
And what time do you close and shut the door that everybody has to be out?
it depends daily. Again, if we have a doctor, one of our volunteer doctors in, we're there until he sees his last patient. But our set hours are 8:30 to 5
Okay.
when we make our appointments for our nurse practitioner to see. If there's something that we can't treat, we send them to Meritus. If it's something that emergency that we can't do in the clinic itself.
Are there many walk-ins?
Yes, there are. There's quite a few. We have a program that's called Youth Overcoming Life Obstacles that sees 13 to 24-year-olds. That's our biggest walk-in population.
And how do they get to the hospital? You have to call an ambulance, or is there
No,
some kind of a
most of them-
vehicle that takes them?
Well, it would depend. It would depend
Okay.
on the situation. But the youth program is mainly coming in. That's not one that we would refer to the hospital. They're coming in mostly for reproductive health and education.
Okay.
So talk about, fundraisers. I know you do the mud
volleyball.
That's
It's coming up,
right?
yes.
When is that?
July 20th.
And I know you're full up on teams, right?
No, we're
You're
not.
not?
We're only about halfway. The cutoff for the early registration fee actually is the end of May 31st.
So just between us girls, how would Ron and Henry and I look in mud? What do you think? And
Probably
Paul,
better than
now
you
that
do
Paul's
now.
laughing. we-
Amazing. I mean, who doesn't want to play volleyball in the mud?
We would lose horribly.
But the fun part is playing in the mud. Have you ever done it?
No.
I did it the very first 2 years. And if you've ever played volleyball,
I
when
have.
you go to jump for a ball to hit it, well, think about being in a foot full of
Mud.
deep in mud. You're not going anywhere when you jump. You're stuck. So you try to jump, but you're not
Okay.
really going anywhere.
All right, interesting. Well,
Is it
that's
still out
yeah.
at Citibank?
Yes.
Okay.
that's
Yes, it
something
is.
for us to think about, guys.
I go past there every time I go to the restaurant and for breakfast. See the holes ready for this year.
Excellent. So if someone wants to sign up a team, so the teams, is the fundraising just from the teams, or do they go out and get people to sponsor them?
They can get people to sponsor them. They can do what's called peer-to-peer fundraising, so they can challenge their friends to donate to their team.
Okay.
So we have some teams that do raise a good, and we give prizes out for the top amount raised.
Okay. If someone wants to register a team, if someone wants to fund a team, where do they go?
They can go onto our website,
Which is?
which is www.mycommunityfreeclinic.org.
mycommunityfreeclinic.org. We will run that at the bottom of the screen.
Okay.
Last questions from Henry or Ron?
If you had the opportunity for one wish that would really help your organization, what would it be now?
More funding. More funding that we were sure that we could set aside and have just in case things start to change. Because grant funding, there are more people asking for the same amount of funding.
Right.
So it makes it difficult to continue to get these grants at the high amounts that.
Do you ever see a day when the amount of nonprofits in Washington County is going to change?
No, it keeps increasing.
Okay.
What's the single most common ailment of people coming in?
We have a lot of diabetics,
Okay.
a lot of high blood pressure,
All right. All treatable.
all treatable.
Yeah.
And as long as they continue to come monthly, they can be treated and we can keep them productive and out of the hospital.
There you go.
All right. Thank you.
Thank you.
This was very educational. Best wishes on a very successful fundraiser.
Thank you.
We'll talk amongst ourselves.
I want to see her leading her volleyball team out there this year.
Me? The clinic
You've done
actually
the polar bear plunge.
I've
haven't
done
you?
the polar bear plunge, yes.
Couple times, right?
Yes.
Yeah. Well, thank you again. Welcome back. We're here now with Stacy Crawford. Stacy is the president and CEO of the Community Foundation of Washington County. Stacy, for our viewers that don't know about Community Foundation, what can you tell us about it? What is your mission? What do you do?
Sure. Our mission is to promote and inspire philanthropy in our community in Washington County. So we are the fund holders, the collaborators of nonprofits, and we work to make sure that the donors' wishes are met within the community. We set up funds that they can decide where they would like to designate, and then we work with agencies through our grant process as well as our funds to make sure that their needs are met.
So as I was looking through your material and as I've talked to people, one of the things that I found very interesting, it doesn't take a lot of money to start a fund.
No, it doesn't at all.
Can you tell us about that?
Absolutely. Our fund level starts at $5,000, and that actually can be established over a 5-year period. So when you break that down, it's $1,000 a year. And now that fund sits and grows until it's $5,000,
Okay.
and then it starts to disperse its dollars dependent upon your wishes.
Okay. All right. Ron?
I followed you guys for a long time. And Stacy was at the college for a while, and what you've been able to do and how they started years ago with Waltersdorf and
Yeah.
the Hensons, etc. And I was down there the other day, and the two Waltersdorf daughters walked through, and we got to talking about what a good job you all are doing. As you move forward and you have the Day of Giving, what you just had.
David.
Yep.
Day of Caring.
No,
Day of Giving, you're right.
Yeah, it was
You're
a Day
right.
of Giving.
Washington County.
Washington County Gives,
okay.
yep.
And how that's come? Do you find you making money by people coming in that are more informed of what you're doing? And
Sure.
what was your total amount dealt with? Over $500,000?
Yes, just last Tuesday, May 7th, we brought in $630,000 in a 24-hour period.
Wow.
And that actually was dispersed out to 96 nonprofits
Okay.
in the area, which is a record number. And we at the Community Foundation are really just the collaborator of that. We don't realize any of those dollars within our budget. We're here to make sure the nonprofits are getting that. So the money comes through our platform, $630,000, over 2,000 unique individual donors within the community that day, and we disperse that money right back out for unrestricted funds for those agencies. And it varies.
How
It's
much of
amazing.
that was new money?
It's hard to tell that actually,
Right.
because it's all done online.
Right.
But our giving is going up. Our dollars,
Yes.
our average gift per donor is up, which is very interesting. And for agencies, we're seeing that they're getting new donors. And we all know that the first gift is really the most important gift to an agency, because that's what starts the relationship that the agency then can continue.
Whoever does your website and plans for that day, they do one heck of a good job.
Absolutely.
When you click in to get it done, what they do, and it's just amazing.
Yes.
How that's all carried out.
Flawless.
And we collaborate. GiveGab is the platform. That's a national platform. But our marketing and communications director, Ali Serbal, within our office, is the one that's training and really managing that site for all of the nonprofits.
Excellent.
So about how many people, how many charities or foundations do you have set up beneath you? And how do you manage to grow the funds that they contribute to establish the accounts?
Sure. Right now, we're managing just over $40 million, and of course, that ebbs and flows with the market on a daily basis. That equates to about a little over 330 funds right now. So the agencies that we disperse to can vary every year, because as a donor, you can come one year and say you want your funds to go to one agency, and the next year, your philanthropic wishes may change, and so it may go to another. Last year, we dispersed $2.4 million out to agencies in either grants and or scholarships to local students. As far as growing the funds, our donors are active within their funds. They're contributing. Our agencies that have agency funds are contributing, much like your prior guest talked about, creating that endowment so that you have dollars to continue to grow and be relied on. So they're doing that through their own individual fundraisers. We also can have the ability to put funds in through online gifts that we get, and we are daily opening new funds for individuals and organizations within the community.
So, one of the things that our former guest talked about is the grant writing and so forth. And it occurs to me, in all of the grants that I've ever run into or helped be a part of applying for, rarely do you find a grant that will fund operating costs. But in this case, if someone wanted to start a fund to have people donate individually or corporately or whatever way to fund operating funds, and wouldn't that be a blessing? To as you grow that, and it might be just a small percentage year, 1, 2, or 3, but. Think about how, is that something you routinely see?
Yes, so we term those designated funds. Donors come in and set up and say, we know that we want our fund to consistently go to one organization. And that goes to that organization typically for operating or unrestricted dollars. Now, the donor could put a parameter on it that they want it to go to a specific program, but we have several of those funds set up, as well as agencies can come to us, and we can leverage the investment power that we have with our larger portfolio and set up an endowment that then can be sent back to them on a disbursement every year. We term those agency funds. So the agency needs to be a 501c3, needs to be in good standing, but they can set up and kind of use us as their charitable savings account.
Wow.
Now, set up as a 501c3, did they need a 990?
And that's going to all depend on what their annual operating dollars are bringing in. But most 501, dependent upon if they're larger, they're going to need to have their own independent audit.
To make sure that they've had it in the last
Correct.
what, year or 2 years?
Last year, yeah.
Okay, in the last year.
Yep. So we hold the funds on our side, and so we have an annual audit, obviously, that we go through, and we file our own 990 at the
Do you follow through with what was done with the money that was given? That the purpose was carried out?
Yes, in some cases. Some donors are less restrictive on what they, we drive everything based upon that donor intent. So as a donor, if you say, I want you to get a report or some sort of follow-up, we would do that for you. If you are less restrictive, then we send the check and they send you a nice thank you.
So what happens in terms of, obviously, we start these funds and eventually we all die.
Sure.
So do you have funds that are set up to continue to manage in perpetuity for the donor? And how are those managed differently? And are the donor's wishes always carried out? I mean, how does that work?
Yes, absolutely. Donors' wishes are always carried out, and that's part of the glory of setting these things up when you're living and having that, whether that mean that you're actually funding the fund when you're living, or whether you're telling us that upon my death, a portion of your estate or a a gift is coming to the Community Foundation for a purpose. We set that up. We always honor the donor's intent continuously. It's invested the same as every other fund. It continues to disperse the same, and that's based upon the wishes of the donor also. And so I say that, but then I take that back and say that as a donor, if you say to me, upon my death, my fund has $100,000 in it, I want 50% of that spent out right now to X agency. We can do that also. So there's really no cookie cutter in the Community Foundation world. We drive everything based upon what the individual donor and or family's wishes are.
Okay.
Now, do you vet the agencies that receive funds, and how does that process? If Ron starts up a charity and he has all his paperwork in order, how do you know that Ron's a good quote-unquote investment to redirect funds into his?
Yes, we do. We do the due diligence on the back end to make sure that everything is in place, so all the T's are dotted and I's are crossed. And that really does involve checking on charitable registration, checking on a 990, asking for lists of boards, checking out their website. In today's day and age, it's real easy to find out what's going on in agencies. And one thing that we do have is we have a 26-member board of directors who are our ears on the ground and in the community, and they're out interacting and will bring any concerns if needed, as well as the staff. So I have a designated donor relations director, and she takes care of making sure that all of the agencies are vetted and have everything in place.
Okay.
I don't know of one organization in this county that has a better audit, annual audit and book that shows everything. So I applaud you for that. Who puts that together? Because it's so comprehensive.
Yep, and I brought a copy. That's our annual Impact magazine. It comes out in November, and our staff puts that together with the help of HBP. And then photography by Dale. Mary Pat does our pictures. And so it is a very comprehensive report that goes out each November detailing the prior year.
They've sent inserts to so many different people, but you really account for what you do. How much difference do you find it from the foundation you worked in at the college to where you are now? You certainly got good training.
Sure.
Can the college put any money through that foundation there into this?
Yeah, and the nice part about this is because many of our organizations, like Nikki was talking about, have funds with us. And so the college realized a lot of the Waltersdorf-Henson Challenge. And so several of their scholarships are held within the Community Foundation. The difference really is I'm working now in an environment where I'm helping everything from elder care to education to animals, you name it. We have a nonprofit in this community that's addressing it. So it's a little bit different than working in a single-minded organization or an organization that's more focused. And that's part of the excitement of the Community Foundation, is we're there for the entire community.
So from an investment perspective, investments can be risky.
Absolutely.
How do you, what is your process of identifying tolerance for risk, and where are you on the continuum in
Sure.
terms of that risk
Yep.
and reward kind of thing?
Yeah, obviously we want to be invested for growth, but to ebb and flow that volatility, watch and make sure that we're not losing a large portion of the portfolio, you know, should we have another 08, 09 kind of situation. We're invested with the majority of our portfolio with Mason Advisory Investment Services out of Reston, Virginia, and they handle about 48 community foundations around the United States. We do have investments that sit with other investment managers within this area. If a donor comes to us with a $100,000 fund, to start a $100,000 or more fund, they have the ability to name their manager, continue with their manager that they have, as long as they stay within our investment policy statement, which basically is positioned somewhere around an 80-20% split stock bond, which helps us to kind of ride that volatility and make sure that if there's a huge issue within the market, we're not losing.
You're affected, but you're not as effective.
Not as effective. And so we've been very pleased with our portfolio over the past 10 plus years that we have been with Mason, and we are realizing our gains. We need to meet a hurdle. I mean, quite honestly, we're spending out 5% of the last 20 rolling quarters, which is our calculation of how we decide what a spendable is for that year. So we have to meet that hurdle of somewhere around 7 or 8% to cover fees and management fees and things like that.
If you look at your fund portfolio, or I'm sorry, your funds that you have, your portfolio of funds, are there areas in the community where, and I know you're not needs assessment, but are there areas in the community where you see or you hear about significant needs where you don't have enough funds, and I'm sure you could probably say all of them, but are there any specifics that you would say, man, I would love to have more money dedicated toward this type of need?
Yes. You know, it's hard. We really do try and remain as unbiased as we can because we're here to be responsive to the community.
Right.
And as part of that, what we do have is funds that are called community funds. And those are donors that have come and said, we don't necessarily know ourselves as donors where the most need is going to be in any given year. So we're going to set up a fund in our name, in the donor's name, but we're going to allot that fund to wherever your grants committee believes those funds should go. So every year we run a grants process with our community funds. We call it the responsive grants. Agencies then request grant funding from us, and we have a grants committee that sits down and reviews and is trying to be proactive for what is happening within the community. So we have not as many community funds because that, again, for the donor is releasing some control back
Right.
over to that grants committee. The fund is still in their name, but not necessarily every year in what they would like to do. So that's where we would love to grow, to be able to be responsive within a given year, as opposed to having a lot of designated funds. But again, everything we get is going back to
It all
Washington
does good
County.
work.
It all does great work.
Overhead operating expenses, I presume they come out of the revenue that you're generating from the funds. But in general, how many paid staff do you have working at the foundation?
Sure. We have 2 full-time paid staff, myself and Sarah Burge, who's our donor and grants relations, and then Allie Serball, who puts together Washington County Gives, does the impact. She's actually a part-time employee, and then Tammy Brown is our administrative assistant out front. She helps us run the events and get everything, keeps us in line.
So pretty low overhead
Absolutely.
with the volume that you're
Yep.
administering.
Our annual budget, operating-wise, is just around $700,000.
Okay.
How do you separate? You have Rotary clubs that, 2 major Rotary clubs that give money. You have the Gaming Commission that gives money. You have Hotel Motel Tax that gives money. How do you keep the same people from going back in and double dipping, triple dipping, and getting anything? And I'm going to add to that, somebody has an emergency today, and it could impair public safety. Can they apply on an emergency
Yep.
basis?
2 wonderful questions. So to answer the first, as far as how do we collaborate with everybody else, our grants committee, I can't speak for others, but our grants committee takes a good look at who's getting funding throughout the year from other sources. And so we consider that within our grants requests. And so, you know, it's always going to be a lot of the same. We really try and be responsive to new needs, and we're asking our grantees to really produce new, innovative kinds of programs to serve the population. Our grants are not as large as some of those organizations that you spoke about, so we're asking them to be a little bit innovative when they request from us. As far as the emergency needs, we do have what we call a FANS fund, and it is an emergency need fund. So agencies can request, it has to be through an agency because we do not pay individuals. So an individual can go to an agency, there's a need, the agency can come to us, and what we have to leverage is our donor advised funds. We have several donors who have set up their charitable savings account through us, and so we are able to say to them, we have this need. Is anybody willing to disperse money from their account to cover that need? And those happen on a very regular basis. If you remember when several of the people were evicted from the hotel there on Dole Highway,
Dole Highway.
Garden View.
Yes.
we were responsive through a collaboration with the Community Action Council to make sure to rehouse those people. Similar to some of the residents, there was a fire in one of the homes that Lasting Change, or the W House, administers. We were able to get bed sheets and new bedding for them on an emergent basis.
So if
there's-
CASA had an issue in
Yep.
one of their houses,
Yep.
the same type.
Yep, we asked them, the agency, to send us a brief of what it is, and then we'll contact them and get the details that we need. And we put basically a proposal out to our donors that are out there that have those unrestricted dollars that are ready to give.
And what was the total you gave last year?
$2.4 million last year.
Out of a $40 million portfolio, that's not bad.
Yeah, we are really pleased.
I can imagine.
And we've been only in existence since 1997, so we're about 22 years old, and we'll be over $22 million of funds given out this year.
Wow.
In total.
So one other question. Let's say that I put a fund together and I say I want it to go to ABC Charity forever, and then ABC Charity goes away.
Sure.
What happens?
Sure. At that point, we have in our agreements what's called a variance power. And so what we do is we hopefully come back to you if you're living, and we say, what would you like to do with this? And then we work together to decide that. If you are not living at that point in time and you have not named any successors as your advisor on that fund, then the board of directors would enact this variance power. And the variance power basically says that at the best of our ability, we're going to honor your wishes as close as we can. So we can go back to an example. Food resources used to be within this area. A fund that would be set up for food resources, when they weren't around anymore, that fund variance power may redirect that fund to something like the food bank or another food or hunger related charity within the area. We always try and stay as close as we can to whatever the donor intent is, and that's part of the relationship that the Community Foundation tries to have with all of its donors, is that we want to make sure that we have succession planning going on down the line.
Interesting.
How does your board turn over? Is there a requirement? Are you recognized under Code of Local Public Law in the county?
No.
Okay. How is there a requirement that your board turn over?
We have term limits. So we do a 3-year term for each board member, and each board member can serve 3 consecutive 3-year terms, a total of 9 years, and then they must roll off the board.
Indefinitely or for 1 year?
For at least 1 year.
Okay.
Yes.
Henry, last question?
Well, you stole my thunder on the one question about what happens to the funds if the person's deceased.
Sure.
So I guess you partner very closely with the local CPAs and how to effectively, we're coming up to paying our taxes, and how can we do this to, because I've seen the emails come out in
Sure.
my mailbox. So how do you work that out, I guess, is a question. If you're coming up towards the end of the tax year, you have a tax bill coming due, well, now's the time to make a rollover to try to lessen what I have to pay.
Right. We're working, but we try and work as closely as we can with our local advisors and CPAs so that they understand the benefits that the Community Foundation can offer. Like you're speaking about the required minimum distribution at 70 and a half.
Right.
That's a great time to then kind of bundle and package that donation into a designated fund for your favorite charity. So we're educating. But again, we are not here to push a certain agenda. We're here for the donor intent. So it's really got to be what's right for the donor at that point in time.
All right. Well, thank you. We appreciate you joining us, and we hope you'll come back again. I know you have one of your events is what is the event in November?
The People's Choice Awards.
People's Choice Awards. So maybe we could do something around that time. If
That would be
works for you.
wonderful. That would be great.
Well, thank you. It was great to see you. Coming up next on the flip side, Fast Five. Stay with us. We're back in 3 minutes. Welcome to Fast Five, where our 3 panelists talk about 5 topics in 7 short minutes, maybe 8 short minutes. Let's start it off. Ron, the Washington County put the Smithsburg Emergency Medical Services on probation at the meeting this Tuesday. Apparently there's some funding issues or lack of funds or concerns about that.
The good thing is they didn't put them on probation for any not making a run or any
Right,
violation
no
of
violations.
calls or something.
They're just, like everybody else, it's tough to get funding, right?
Well, the staff has been charged with going out, finding out just what they need by next week. The county gave them that vote of confidence that they will do something, to give them the money. The issue that I have with it, within the last year, there was a group of the same EMS that went into the public hearing when he was going to put, remember when they were going to add to a development out there, and
Right.
the guy was going to give land, and they were going to build a new building and do things. My question is, what's happened to all that money? I see their current president just went in not long ago to take over, but you can't go in and add staff, because as you see, they 24 hours on, 72 hours off, and they wanted to help their employees, so they wound up with a 25% higher expense for personnel. So it was something that wasn't thought out well, and I not only do I think that the Smithburg EMS should be held accountable for that, I think the county should be also. There should not be the ability for a fire and rescue company just to do what they want to do without understanding there is a repercussion to what they did. And I think they did it, and I do think that will all be changed in the next couple of months.
Okay. So I'm going to stick on that one. I had a completely different question for Henry, but I'm going to stick with that. Henry, what are your thoughts on that? Now, these are, as I understand it, these are independent companies.
Each one's an independent company.
Does the county have the right to go in and dictate those type of operating policies and procedures to independent companies?
So in a loose sense of term, you're asking me, does the county have the right to nationalize the EMS service within the county?
Sure, okay.
Okay. And I think for public safety and welfare, I think the county needs to partner with our EMS services to provide them better wise accounting practices. I'm not saying that there was accounting irregularities there. I'm not insinuating that at all. But they have the highest payroll of any EMS within our community. Okay, and so why are they higher? There's concerns with how the funds, at least in my mind, when you're up nearly $500,000 and the next closest, Ron, you may correct me, is somewhere around 350.
About 505, yeah.
Yeah.
Not too far. That's 25% more.
Yeah,
What you're saying is right.
It's a lot. So, are they operating with standard business practices and best accounting practices to account for the money that they have coming in? Why is their payroll higher than the other community organizations such as themselves? And I think the county can partner with our local community groups, because this is not the first one that has, fallen ill with this. Now, the good thing, the county gave them a vote of confidence. The county has already provided them with the loan necessary to try to get back on their feet,
right.
which is all positive. Do we
Now,
need
that loan doesn't start till next Tuesday.
Right.
We have to see how much the loan. The vote of confidence is in what the amount will be.
right?
All right. Let me,
But
go ahead. No, you finish your thought.
the thought, 24 hours on, 72 hours off. The rule is 24 hours on, 48 hours off. That extra burden, which there should be, a guideline what you do, increase their expenditures by 25%. You can't do that.
No.
And it's already showing there was a problem. There was money there, and I've seen people that's written said, well, I was there and we had a big surplus. Well, who made the decision to go from a 24 on and 72 off and then come back and say, well, we didn't know it was going to have that effect? Goodness gracious, you at least ought to know that.
Well, so does this point to a larger problem that we've talked about on this show many times over the last 6 years that the show has been on, that we need to develop a county-based funding model, whether that's a fire tax or EMS tax or some other funding that does that? And does that give the county then more authority, more responsibility to step in and, I'm not going to say dictate, I'm going to say help, because clearly the situation as you described it, there are errors of omission and errors of
Yes.
commission. I'm assuming this is an error of omission. Somebody just didn't think that it was going to have that impact legitimately, and guess what? It did. And maybe it was just that. Maybe there were other contributing factors. Whatever the case may be, where we are, and would a county-based funding model solve that issue? Ron?
You're saying a county-based funding model. I'm not bothered about the funding model. I'm bothered about recovering funds that's available through insurance and third-party pay. The county needs to have, a lot of these independent companies go out and get somebody to do it on their own. They may be paying 8%, 10%, or whatever. CRS does it for 6%. There should be a county department that handles the billing procedures for all of them. Then you'd know what the accounting is, and you wouldn't, go off the rails like in this particular case they did. You will see, in my opinion, in the future, there will be a model that the county goes through someone else and that billing to get the money back in.
Well, one of the conditions is Smith Valley and Klein, SEK,
Kearns.
is, Kearns.
Yeah, Smith Valley Kearns, yeah.
All right, that they are going to go in and they're going to try to, in the next week, put things together so there's something to present to the county commissioners. But I agree with you, Ron, that we need to have some type of government entity in an advisory capacity and maybe even an accountable capacity to direct how the funds are going to be.
Why not have the department where it all goes through and you control it and you don't have to put the extra millions out there if you saved enough money to get money back in that's out there?
Prove it on the paper, that will work.
We'll talk about that in another segment. This is Fast Five, but I think that's a good point, Ron. Developer suggests that a new stadium would spur other investment. Ron, do you believe that is true?
When a developer of substance that's got money to put up and development says that, then I will listen to that. Until there is a defined issue on you're not going to build a stadium. Build a sports complex where the grounds and the land is used all the time, not a stadium just to sit there.
Okay, but
and why they won't? Why won't they talk about that?
Well, I think they have talked about that before.
Well, what? It's a stadium. It's a stadium proposal.
I think, is that a generic?
No, it's not generic.
Okay.
A stadium is a stadium.
Okay.
A sports complex is totally different.
So, Ron, are you proposing, and one of my thoughts is, when I see the term stadium, that we turn it into a sports complex. We're talking about indoor soccer facilities, basketball. If we're going to erect and put $35 million into downtown or greater, why not make it a community/civic center that you can, as a complement to the ARC. We all know how fine facilities that are out over at HCC. Put a facility in that is complementary to that. So not only can we host minor league baseball in town, we could host minor league football, but we can also host maybe a semi-pro on a soccer team or basketball team. I mean, there are smaller leagues, they're not major leagues, that could come in and put programs together, plus have a convention center. So if we're bringing people into Hagerstown, because of all the destination that we have here, they can actually host meetings and accommodate that.
Ron, how important is it to have this sports complex, stadium, whatever you want to call it, how important is it to have it in the city center?
I think it's important.
Okay.
I supported it there before and still support it.
Is there enough land at the Baltimore Street location or another location in city center where that could be built?
I was there when Schaefer did it at Camden Yards, and they said it couldn't be done. I watched him. I was there the day they broke ground. I watched what they did, and they did it well. But things are used far more. They use a lot of old buildings, and I think one of the local developers said that they would buy up the hotel and they would do that. You need a more grand scheme of plan with somebody with money to make those kinds of proposals. Remember the proposal? What was it? One of the city councilmen had somebody with $14 million coming to the table. Well, you can't have somebody that doesn't have money determining what you're going to do. You can't grant fund everything. So it's...
But do you view the stadium as tossing a coin into still water? All of a sudden we start to see a ripple effect starting to come out from where that stadium is and start building up economic impact. So the investment that we might have from the Maryland Stadium Authority to put that facility in place, all of a sudden is an economic driver for the surrounding areas in downtown.
Absolutely. I have the Maryland Stadium Authority and the Maryland Economic Development Corporation doing it together. I don't think we're adding the entities that are available in the state and locally that's really planning to do this. You can't do it just by people talking about, I'm going to buy the Dagmar Hotel. That's not going to solve anything.
But you've been on the county side of government. How much do you think between the city of Hagerstown and the county government that they may need to invest to get this to move forward?
I think the private sector can be brought in to do a lot of different things. I think the theater has just shown you can raise $12.5 million from the private sector. I can see the people at the you know, out at the, remember the ice hockey? Mm-hmm. We had the gentleman in here to talk about the ice hockey rink. I think they can raise money, but unless you get away from just baseball, you're not going to raise the fund. Kristen Alshire's had a lot of good ideas, things that he wants to do. Why can't that all be put together in the same area? Use the same parking, use a lot of the same entities and infrastructure instead of just doing it as a stadium.
What about the homeowners on Prospect Street?
Good view.
Good view, okay. Well,
All right, we're going to leave that one there. All right, Washington County last year had the second highest incident of opioid-related deaths. Despite people like Emily Keller, and I don't think that anyone can say that Emily has not brought a lot of recognition and a lot of publicity to this whole opioid crisis, and others like her. I think she's kind of the standard bearer at this point, at least in my view. Ron, this is a national issue. It's not just Washington County, but this is not an area. This is not a time where being second is a good thing.
Well, it's just like teen pregnancy. Teen pregnancy, we're one of the highest in the state. You know, year after year, only beat out by Baltimore, maybe one other one. So that's not unexpected. I think a lot of it comes from what the prison draws into the community, that stays in the community, that gets hooked on, you know, bad drugs, fentanyl, based with what, heroin and things like that becomes issues, and it's something that we can't be proud of. But then again, there are a lot of people diligently working on trying to correct the issue. So,
Henry?
Well, you know, you mentioned Emily Keller. She's brought awareness to the issue that we have in the community. Our problem is there's still supply in the community. And, you know, that's beyond what Emily's efforts are. She's trying to deal with those who are already addicted to it, trying to stem it, but how do we attack it? What is causing it to be such an epidemic within Washington County versus if we go over to Frederick County or over to Cumberland, you know, Allegheny County? What are the issues causing it? It seems like we are seeking treatment rather than preventative care. To get ahead of the train? Is it because of economic situations? Ron, you alluded to the issues that we have with the prison. There's a myriad of issues that are allowing this to take root in our community, and I think we need to go down a level and really start to tackle it.
All right, 5 victims suing the Vatican for release of the names of sexual predator priests. Henry, what say you?
It would be an interesting thing for the 5 victims to be able to sue a state, a separate country for this information. Yeah. That's really where the crux is. You know, who's going to have
are you saying the Vatican's a separate country?
The Vatican is a separate country.
Okay, I just want you to be clear.
Yeah, so it would be quite an issue of how that would be handled by the world courts, so to speak, in that regard. Do they follow it locally? What if the Vatican says, listen, we're not going to do it regardless? Yeah.
But why shouldn't it be brought out publicly like every other person that gets caught, where the pedophiles and stuff are on TV?
I couldn't agree with you more, Ron.
They all should let the light shine in, and they should be known. Maybe some of them
Maybe the Pope
stop.
will.
Well,
all right.
I bet he's got some people that don't want him to.
Last subject, the birth rate in the United States of America, lowest in 32 years. What's up with that, Henry?
Well, one is, I think, the availability of birth control. It continues to be becoming more readily available. There's other alternatives. The interesting thing is the birth rate of the 21 and lower population is less. That's reduced. I think that's a good thing.
Teen pregnancy.
Teen pregnancy is reduced. Maybe not in Washington County, but it's reduced nationwide. Even those in their 20s, it seems like the people are trying to establish themselves in their life balance. They're having children later. It didn't go up, I think, past the age of 40, but in between that, the percentages were actually not too bad. So they're starting families a little bit later, but the other, we didn't see, we're not in a sustainable reproductive rate for our country's population. At this point, our nation will be shrinking based upon where our population, the birth rate that we currently are under.
Ron?
We got 3,800,000 births a year. Who's going to pay the taxes for you to retire off of? I probably won't be around by then, but you will be. You need somebody to pay in, and you too, Jim, to pay into the taxes. What the issue is now, it's hard to believe with the economy the way it is, there isn't more children being born. It just, the people that I know, it seems like families are growing. A lot of the young folks that I know their families are growing, but nationally, they're not. So it's going to be a problem ultimately. You're going to need a workforce. You're going to have to deal with
the robot in the grocery store, yeah.
You're going to have to.
We won't have to worry about minimum wage anymore, right?
You won't have to worry about the minimum wage.
There you go.
going to complain about them.
We'll figure out something. Tonight, as a show, we celebrate our 300th episode. We've been on the air, going on 6 years now. It has been a pleasure to be on both sides of the camera in this endeavor, and I hope that our viewers find it interesting, and I hope you will continue to find it interesting. In fact, I hope you'll like us on Facebook, follow us on Twitter, send us your comments to feedback@flipsidetv.com. That's feedback@theflipsidetv.com, and most importantly, please join us again next week for episode 301 on The Flip Side. Good night.